Los originales, Community Health Worker Radio.
Hello everyone, this is Dr. Liliana Ponce. Hola a todos. Hoy vamos a tener un programa bilingüe porque tenemos el honor de estar con dos expertas y dos colaboradoras que queremos mucho y van a estar hablando de lo último del COVID-19. It is my pleasure to start with Sara. Hi,
Hello.
Sarita.
Hello, wonderful to see you.
Yes, it's great to see you. And this is not your first time.
It is not. I'm so happy to be back.
Exacto. Entonces, esta no es la primera vez que Sarita está con nosotros. Ella es de una organización de Spokane que se llama We Are DA y trabaja muy cerca con el Departamento de Washington. También tenemos a Shireen Khinda. Hi, Shireen. How are you?
I'm great. How are you doing, Doctora?
I'm doing well, and we are very happy to have both of you. And also, it's not your first time in the radio, and we are very happy, Shirina, that giving you the welcome because the work that we are DAs through you and through Sarita are wonderful. Queremos darle la bienvenida a las dos, a Sarita y a Shirina. Ambas trabajan para We Are DA, es una organización que está en Spokane y trabaja en la importancia de llevar esos mensajes que tienen evidencia médica a la población, especialmente en el COVID-19. Well, you know, we have almost 3 years, no, that we are dealing with COVID-19. And many things we have learned, and also there are many things we need to learn because the COVID-19 is not a disease that have been say everything, you know. There are different viruses, different either vaccine, different risks from different population, and symptomatology is not the same in children and adults. Entonces, Sarita y Shireen, estamos aquí en la radio y sabemos que hay el COVID-19, ya tenemos casi 3 años y que tenemos que hablar del COVID-19 porque no es una cosa que sea permanente, eso afecta a diferentes poblaciones de diferentes maneras, hay diferentes personas que están a riesgo y otras no. Entonces, I wanted to ask the first question and I wanted to Shireen to answer, and is what is the last thing about the COVID-19 vaccine?
Yeah, so, you know, I'm not a healthcare professional. I'm a communications professional. But really, I think the message still remains that staying up to date with COVID-19 vaccines is really important for everybody. It's one of the most important tools to help everyone stay safe and healthy around you. We know that some people cannot get vaccinated if they have health issues. And so if you are able to get vaccinated, you should really talk to a doctor or a nurse that you trust, and know that there are doses available still.
Thanks for that information. Entonces, mi pregunta para Shireen fue que, ¿cuál es lo último del COVID-19 y de las vacunas? Entonces, ella nos contestó que aunque ella no es una profesional de la salud, ellos trabajan mucho y ella sabe mucho de la educación, especialmente en COVID-19, y nos dice que nos tenemos que seguir vacunando para poder inmunizarnos, porque aunque hay personas que están enfermas y no pueden tomarse la vacuna, los que sí podemos la deberíamos de tomar o ponérnoslas porque es el mejor método para no infectarse del COVID-19. Y si nos enfermamos, tal vez no tenemos las probabilidades de morir. Shireen, thank you for that message, and I agree with you. I wanted to share my experience. I get all my vaccine, including the booster, and then I get the COVID-19 and I feel miserable, but I am alive. Quiero decirles, también le dije a Shireen que gracias, porque es cierto, la vacuna es lo único que te va a proteger. Quiero decirles que a mí me dio, y gracias a Dios no fui al hospital, no estuve grave y estoy viva. Así que si quieren sobrevivir a un ataque del coronavirus, por favor, pónganse la vacuna. If you want to survive to a attack of the coronavirus, please take the vaccine because it's the only thing that can save your life or go to emergency room. Sari, we are going to talk with you. And now I wanted to, why the recommendation of the COVID-19 vaccine? You know, when we start wear one, they say children less than 3 years can no, babies now they can, adults were the first, you know.
Yeah.
Why is not like every year we listen everything and people is confused?
Yeah, it is. It's a constantly changing conversation because COVID itself is constantly changing. And I think we always would recommend, first and foremost, to speaking with your doctor, as Shireen said, your nurse, someone trusted, a medical professional. Also visiting the Department of Health website. There's still a lot of information there about vaccine requirements, changes to the vaccine, the CDC website as well for those that like to search online for content. It's a great resource that constantly is being updated because the last thing that our State Department of Health officials, that those at the national level want, is for people to be confused or not have the information that will really keep themselves, their friends and family safe. And so, as you mentioned, there's been a lot that's changed in 3 years, of course. But really what's most important is to remember that the best way to protect yourself, your friends and family, if you've been vaccinated, is to keep getting boosted as much as you can, as is recommended by your healthcare provider. The booster vaccine is the best way to protect yourself if you have been vaccinated. And again, those timelines change. And so to really speak with your doctor, your healthcare provider, and get online research as well to understand if you qualify for a booster, how to receive your booster, that is the best way to get that information. When we think about individuals who have what we call immunocompromised situations, their immune systems are quite different than someone who is not immunocompromised. Maybe they suffer from other healthcare conditions where being extra protective, getting that booster would really help them to stay as safe and healthy as possible. Having conversations with your healthcare provider is the best way to stay informed. And these recommendations do change, they have changed, but the most important thing is to get the information that you need when you need it.
Thank you, Sarita. I'm going to translate. La pregunta que le hicimos a Sarita, porque ya tenemos 3 años y han habido muchos cambios, ¿verdad? En indicaciones en que se tiene que tomar una dosis, que los niños pueden, que los adultos no pueden, que hay que priorizar a la gente que tiene el sistema inmune bajo. Entonces, Sarita nos dijo que sí, que era cierto, y eso es porque el virus no es estático. Como ustedes saben, el virus cambia, hay mutaciones y también las indicaciones. Es una enfermedad nueva que estamos aprendiendo todo, ¿verdad? Entonces, las vacunas también son variables y, por ejemplo, pero lo más importante es hablar con tu doctor, estar al día con la información que el CDC y el Departamento de Washington ponen, porque ellos... la información que ellos ponen viene de la evidencia médica, de estudios. Estén atentos que si les necesitan ustedes una dosis y un refuerzo, tienen que ponerlo, porque lo más importante es poner el refuerzo para estar inmunizados. Entonces, vamos a repetir lo más importante, que es estén al día, consulten y vean las información que da el CDC y el Departamento de Washington, y también hablen con su médico o cualquier profesional que trabaje en el área de vacunas para ver cuándo le tocan sus refuerzos y pónganse sus refuerzos. Sarita, I wanted to share that the booster, there are 3. The first, we have the first vaccine, and the second, we have the other. And then we have a booster only for the one of the coronavirus. And now is one available for people that is 60 years old. And this is the last recommendation from the CDC and Washington. Can you confirm that?
Yes, when we think about the ages of individuals as well, it is so important to follow those guidelines because the original vaccine, when it was introduced for children, or, as you mentioned, it started at a certain age and then it went back to the 6 months age. When we think about those 65 and older, a lot of times those individuals are really paying attention to maybe other things in their health at that age. And so following those booster guidelines, currently there is an updated chart by age on the State Department of Health website. So I would definitely recommend that listeners and viewers go to that website, see where they fall within those categories of age, and then they can determine what they would qualify for.
Fantástico. Entonces, ahorita le dije, ¿verdad? Yo estaba hablando de que los refuerzos, pues la primera que empezó fue para el primer coronavirus y ellos no incluían a los niños de 6 meses, después se incluyeron a los niños y también la vacuna de COVID-19 que se aplica a las personas mayores de 65 años, es un poquito más fuerte porque el sistema inmuno de ellos es más débil, pero que está en la página electrónica del Departamento de Washington está la información de los boosters que nos toca a cada uno acuerdo a la edad. I wanted to ask Maria that is helping us with the radio to looking for this web page and here, Maria, read my mind. Then you can go to doh.washington.government.co-19 y ahí van a encontrar en ese correo electrónico del doa.washington.governor-covid-19 van a encontrar la información acerca de los boosters. Well, this is good. And before we go with Shireen, I wanted to read because we have a lot of people joining this beautiful conversation, and I wanted to read for you the message that they have. La señora Reina, ella dice, good morning. Thank you, señora Reina. I know she is from King County, and King County say presente. Maria Moreno, she say good day, and I know she is from Olympia, and she say present. And then we have Maria Chuquerunta, she is from Lewis, and she say welcome, Sarah and Shireen. Thank you for buenos días, Sara and Shireen, and gracias por estar en los originales radios. The next one is Blanquita Mendoza. She is from Sunnyside. Saludos desde el condado de Yakima. She say hello from Yakima, and all of them are community health workers. And they work with the vaccine, the COVID-19, educated people, referring people to get the vaccine, helping to locate a place to get the vaccine, and working also in our care van campaigns. Así que María Moreno dice, hello, Sarita Shireen from Pierce County. Thank you, María. And Rolando dice, hello, Dr. Ponce, and welcome, Shireen and Sarah. Thank you, Rolando. Rolando also is for Thurston County, and another great champion from the community. Claudia Mulero say, good evening, Dr. Ponce, and welcome from Lacey, Washington. Oh, I love it. We are listening for everybody, and I know this is Julon's time, and I really, really, really thank you to everybody that's joining at this time. And we have a question. And Shireen, I want to pass this question to you, and the question is there any information about new cepa about COVID-19 or new kind of virus or COVID-19 that you have for our community in Washington?
Yeah, great question. And thank you, everyone, for the nice words. It's great to be here with you all. Yeah, certainly, as Sarah mentioned, the DOH website is the best place to find all of the new guidance around COVID-19. If you prefer the CDC, their website is also a really great one to check to stay up to date on guidance. One thing that I could speak to is specific to children. So if you have kids or know someone that has kids, because of COVID times, a lot of doctors' offices may have closed and people may have gotten behind on child vaccinations. And so really important to, if you're taking them for a checkup, be sure to ask about the COVID vaccine and how your child can stay safe around COVID. There are certainly vaccines still available. They're still free of charge for now. And so take advantage of that while you're having your kids be vaccinated or know of others who have children.
Entonces, María le hizo una pregunta, ¿verdad? Nuestra querida señora María Moreno hizo una pregunta a Sarita y a Shireen. En esta pregunta era acerca si hay otra cepa de COVID-19 en nuestro estado. Y ella contestó que la mejor manera de saber es yendo a la website, ya sea del Departamento de Washington o del CDC. Y lo más importante que tenemos que tener en cuenta es los niños. Los niños también se afectan del COVID-19 y hay que tener en cuenta de que la vacuna sigue siendo gratuita para todos y hay que tomar a ventaja. Entonces, muchas personas no están vacunándose a los niños y entonces cuando vayan al doctor pregunten acerca de la vacuna que se tienen que poner y pregunte si está available o si está disponible para que le pongan la vacuna a los niños, especialmente a los menores de edad. Thank you, Shireen, and thank you, Sarita. And I believe we are going, it's the time for, oh my God, it's 20 minutes already that we have here. Time is passing. And we are going to have a information, a commercial, I say information on our commercial that is all about health. Entonces, gracias Sarita y gracias Shireen y vamos a unos cortes educativos.
If I self-isolate for 5 days, I should wear a well-fitted mask from day 6 through 10.
Son organismos diminutos que viven a nuestro alrededor y nos pueden enfermar si entran a nuestros cuerpos.
Navali nashishikomi COVID-19 tutana kina vacuna. No se puede ver el virus con los ojos solo bajo un microscopio.
Tanto como síntomas de COVID-19, tanto y quinto y ve un TV.
Podemos recibir una vacuna contra el COVID-19, incluso si tenemos otras afecciones médicas. Vacúnate.
Este mensaje es patrocinado por Community Health Worker Coalition for Migrants and Refugees y el Departamento de Salud del Estado de Washington. Para más información, visita doh.wa.gov/COVID-19.
Well, this beautiful educative short cuts is from our children from Skagi, most of them children from migrant and refugee. And you listen then in different languages, including Mesoamerican Indigenous. Entonces, estos cortes educativos que ustedes han visto son de nuestros niños de Skagi, muchos de ellos niños, hijos de nuestros migrantes y refugiados. Ellos hablaron en diferentes lenguas, incluyendo español y lenguas indígenas. I don't want it to pass because there's a lot of people writing, I believe, comments and also asking questions. Let's add to talk about that. And we have a Claudia Padilla. I know Claudia, she's from Seattle, and she say hola, salud. She say hello, and getting, and thank you for keeping us informed. Thank you, Claudita, and we love that you are here with us. Claudia Morelos say thank you. Gracias, doctora, por proveer esta información a nuestra comunidad. Un beso y un abrazo a todas. Gracias. También tenemos Sandra, dice, Sandrita say, hello, doctora Ponce and your guests. Thank you, Sandrita. And Rolando dice, the COVID-19, dice, is the COVID-19 an issue? And should we take care about that?
I'll go ahead and start. Absolutely. And I really appreciate this question because it's very easy to think that it is completely behind us because of restrictions being lifted and changing. And you think back to 3 years ago, and even 2 years ago, 1 year ago, and it's continued to get less and less at the global scale, but it's still felt here at home. And so keeping a focus on your own health, the health and wellness of your family and friends, and really thinking about the vaccine, if you haven't started the process and you're able to based on your own health, or if you have taken the vaccine and you're looking into the booster program and the booster timeline, that is the best way to protect yourself. So even though masks are not required like they were before, there's always still a lot of ways to keep yourself protected in addition to being vaccinated. If a mask makes you feel more comfortable in a certain setting, especially a big crowd, absolutely. It was very proven through that timeline when it was required, that is a great way to protect yourself. But that said, keeping a focus on COVID still being very real, even though it is not at the same level as it was 3 years ago, is really important. And again, we can't say enough how much information there is available online from medical professionals to really keep ourselves informed.
Thank you, Sarita. Ok, Rolando nos hizo la pregunta, ¿verdad? Y la pregunta de Rolando fue que si el COVID-19 aún sigue vigente y por eso es importante seguir cuidándonos. Entonces, Sarita dijo definitivamente que sí, aunque no tenemos los mismos casos y la mortalidad que tuvimos hace 3 años, hace 2 años o hace 1 año, el COVID-19 sigue en nuestro estado, hay gente que se sigue infectando y no debemos de bajar la guardia, hay que seguir tomando precauciones de cómo usar máscara. Está bien demostrado que si uno usa máscara, principalmente en los lugares públicos, uno se puede cuidar más y tiene menos probabilidades de infectarse. Entonces, vamos a recordar, ¿verdad? Todo esas recomendaciones y usen la máscara cuando pueden y estén al día con su dosis de vacuna. Thank you, Sarita. We have also more, we have a very active, it's very important, for everybody and the community health worker. They have this radio, to learn from the expert like you, to communicate to the community. All of these people here now, they have an important role, and this is why we keep informing them. Maricelita López say, hola, buenas tardes a todos. Hola, Maricelita, thank you for being here with us. Claudia Mulero say, can we please ask them what they think about the vaccine for kids? Do you recommend? Entonces, la pregunta de Claudita Mulero es, por favor, pueden preguntarles qué piensan de la vacuna para niños y que si la recomiendan. Then, who want to answer the question?
I'll jump in. I spoke to this a little bit earlier about children. Again, would definitely recommend that folks ask their child's doctor, their pediatrician, or a nurse that they trust about guidance, because we can't give you that advice for your children and what their needs are. But certainly, the state and federal government has recommended vaccines for children as young as 6 months, and those vaccines are still available. So certainly ask your healthcare provider about that.
Shireen say, claro, sí, las recomendaciones para las vacunas para los niños son para los niños de 6 meses para arriba y que siguen vigentes y que deberíamos ellas recomiendan que todos los niños se vacunen. Thank you, Shireen. This is a great recommendation and still a good recommendation for everybody. Entonces, seguimos promoviendo la vacuna no solamente para adultos, sino para las personas mayores. Then Victor Jimenez say, hello, Victor, we're missing you. He say, hello, Dr. Ponce, and welcome to you guests. Thank you. And then we have other questions or comments. Isabel Gaspar say, hola, hello, good evening. This information is very important for the community. Thank you, Isabelita. I know she joined us also from Giacomo. Then we are going to talk more about the different kind of vaccine that we have, no? And there are many confusion about those vaccines. And I am not sure, if the question about the children was trying to ask about the different kind of vaccine, but we're talking about monovalent, bivalent, Are both of them efficacious? What are the differences? Which one is for whom? Entonces, vamos a hablar ahora de los tipos diferentes de vacuna. Hemos escuchado monovalente, bivalente. ¿Quién la debería de tener? ¿Quién no? Son las dos iguales. Please feel free to answer.
Thank you. I'll start just with some background. And then Sarah, if you have anything to add, feel free to share. Well, so initially the COVID vaccine that first became available was called a monovalent vaccine. It only addressed one strain of COVID-19. As the pandemic over time evolved and COVID-19 had different variants, several different variants over time, they needed to develop a different vaccine to combat the other strains. And so one of the other vaccines that combats more strains is called a bivalent vaccine. And so that is kind of the main difference. And I'll let you translate that, Doctora, and then Sarah, if you would like to add.
Entonces, ¿verdad? Como vimos, la pregunta era que cuáles son las vacunas monovalentes y bivalentes y cuál es la diferencia. Entonces, Shireen nos dijo que la diferencia es que empezamos con una vacuna monovalente porque solo era para el primer tipo de virus que nos infectó, ¿verdad? El primero que era bien letal porque era el primero, pero después, ustedes saben, hay diferentes variantes. Entonces, hay la necesidad de poner una vacuna que actúe no solo para el virus que se había criado, pero sino para los nuevos virus que están surgiendo. Entonces, por eso se llaman bivalentes. Yes, you can continue.
Yeah, and Sarah, go ahead if you wanted to share more about the current guidance.
Absolutely. As Shireen said, this evolution of the vaccine towards a bivalent vaccine was purely due to these different strains of COVID-19 and really being able to come up with a way to protect individuals against these multiple strains. So for those individuals that are listening and again watching that work with members of the community, I think what's really important is to know the difference, but really understand that the move now is towards the bivalent vaccine, that booster. When you think about conversations with your doctor, with your nurse, knowing that language is important, but it is in many ways, their job, their responsibility to help provide the information to their patients as well. And so ultimately the move now is towards the bivalent vaccine, again, to ensure that it addresses multiple strains, provides the most protection possible. But again, really recognizing that it is up to your physician, your doctor, your nurse, someone that's trusted in the medical field who would also know that, would also have that recommendation, so that if you ask for the vaccine at a visit, at an event, really what is the best protection, and that is the bivalent vaccine.
Thank you, Sarita. And Sarah also reinforced the information that Shireen is giving. Gracias, Sarita. Ella está reforzando la información que dio Shireen, pero lo más importante entre la monovalente con la bivalente es que la bivalente les va a proteger para los diferentes tipos de variantes que existe del COVID-19, mientras que la monovalente solo te protege uno. Pero al final, el que va a decidir eso va a ser tu médico o el personal de enfermería que te está viendo cuando tú vas a poner la vacuna, ¿verdad? Entonces, ustedes pueden hacer preguntas. Es muy importante que ustedes sepan que hay dos tipos de vacunas, la monovalente y la bivalente, porque así ustedes pueden saber contra qué variantes se están protegiendo. Thank you, Sarita, for that great information. And we are going to continue because I see that there is a big list of questions, and then also message from our community health worker, and Maria, you wanted to share them. Victor Jimenez say, how many boosters for COVID-19 are currently?
Sarah, do you want to jump in with more specifics about the kinds of boosters that are available? Again, our ultimate guidance would be talk to your doctor, but we can certainly share just a little bit about the boosters that are available because they do address more strains of COVID-19.
Absolutely. One of the ways to think about the booster doses is by age as well. And so there is an opportunity again for those 65 and up to receive a booster, again, to really help them protect themselves with other health issues that may come about due to age. And every booster available and dose schedule is available on the State Department of Health website by those age groups. So I would strongly recommend visiting that webpage because that is the best place to get the most up-to-date and accurate information as things change. But ultimately, when you think about kind of booster doses, types of boosters, your physician, your nurse would have the most information in addition to what's available online. But it is good to know that those 65 and up have an opportunity again to receive a dose that would really support them in their health as it changes through age.
Fantástico. Entonces, Sarita, por la pregunta, ¿verdad? Que era ¿cuántos refuerzos hay? Bueno, eso depende de la edad y lo mejor para saber específicamente cuántas dosis tienes que tomar y los refuerzos es irse a la website del CDC o del Departamento de Salud. Pero ahorita se está ofreciendo un refuerzo a las personas que son mayores de 65 años o aquellas personas que tienen enfermedades como inmunológicas o cáncer y tienen su sistema inmuno bajo. Entonces, para más información, visiten la página electrónica del departamento doa.washington.gov COVID-19, porque también varía de acuerdo a la edad y al tiempo, ¿verdad? Cambia. Entonces, decir una sola cosa, pues no es es mejor visitar las páginas que tenemos para toda la comunidad que nos dan la información correcta. Señora María, thank you for your answer. Gracias por sus respuestas. Nosotros apreciamos que nos ayuden en este programa el día de hoy. Thank you, Maria. And I know that all of you, community health workers, are eager to learn from our expert, and this is why we have today Sarah and Shireen from Washington, DA, who are working closely with the Washington Department of Health and CDC and giving the right information and demystify all the lie about the COVID-19. And Maricelita say, hola, I have a question. It's true that the COVID-19 left sequelae that are very strong, but they can be recovering. Sometimes I listen that, but I am not sure if this is true.
Well, I'll try to address this one way, and certainly if there's more questions, feel free to put them in the chat. Well, so right over time, the COVID vaccine or the COVID itself has mutated, right? It has changed. That is mainly why, Dr. As you said at the start, you had certain symptoms. Other people have had very different symptoms and been affected by COVID very differently. And the goal of the vaccines is to, as much as possible, combat the effects of COVID, right? To help protect people against how COVID might actually impact them, right? So getting vaccinated is still the best way to ensure that you avoid ending up in the hospital or more sick than you might without a vaccine. The data still is in line with that those who are vaccinated are potentially having less intense symptoms and are not ending up in the hospital as frequently as folks who maybe are unvaccinated. So still really important to get vaccinated if it works for you, but be sure to talk to your doctor about it to make sure that that's the right choice for you and that you get the right kind of vaccine to protect you against COVID.
Thank you, Shireen. Entonces, la pregunta de Marcelita was that it is true that COVID-19 gets sequels and is very strong, but it disappeared, because sometimes I listen that, but I'm not sure that it's true. And then Shireen say, as we say, you know, the symptoms are not the same for, los síntomas no son iguales para todo el mundo, ¿verdad? Algunas personas tienen unos síntomas, los niños tienen síntomas diferentes que los adultos, las personas que están inmunodeprimidas también tienen. Lo más importante es saber que si estás vacunada, vas a tener menos síntomas graves y vas a sobrevivir. Así que lo importante es vacunarse. Y acerca de los síntomas y las secuelas, si hay síntomas y secuelas, y las personas que sufren más esos síntomas y secuelas son las personas que no se han vacunado. Y sí, I also wanted to give extra information, you know, about the sequel and the symptom. The COVID-19 is a very smart virus, and it's multisystemic. What is mean of that is that they attack all the body, all the organ, and not only one section. And we have been noticed long COVID-19, and that includes a lot of things, affection in the eye, affection in the reproductive health, affection, you know, in chronic condition, particularly related to the lung. Entonces, and then I wanted to reinforce what Shireen and Sarah say. The people that have least sequel or long COVID-19 are the people that has vaccinated and have the booster. Entonces, yo quiero añadir algo más de lo que dijo Shireen y Sarita, que sí hay secuelas, y las secuelas, el COVID-19, el coronavirus, es un virus que afecta todo el organismo, es multisistémico, y los síntomas y las secuelas dependerán de lo que va a afectar, pero hay trastornos a nivel ocular, a nivel de los pulmones y otros aparatos del sistema. Entonces, para mantenerse uno a salvo, digamos, pongámonos la vacuna y pongámonos el refuerzo, por favor. Thank you. And we have a more question. We have Alma Rocío Gutiérrez, and she have a comment. She say, we know that the most vulnerable community are field workers, canary of construction workers, etc. And all of them may also be the easiest to contract COVID-19. And the economy often prevent them from stopping work. Like the Department of Health support them? Good question. And I'm going to ask them to answer, and then I'm going to translate in the Spanish.
Sure. Thank you. That's a really great question. We know that there are community members who are in, you know, congregate housing or settings where they're working together with many people and may have more exposure than others. And that it's really unfortunate, but we want to make sure that as much as possible that they're getting the support and help they need as well. So there is a program called Care Connects, and that program is one that helps to provide some critical services to community members while they have COVID, to help them recover over time. And so we can certainly share the link to that service as well. And that is something that in some cases may still be available. It depends on the region and also the funds for that program, because the pandemic is scaling down. There may not always be funds available, but that is a program that has existed. Additionally, the State Department of Commerce has some other programs to help small businesses and also some community members as well. So we can certainly look for those and share those in the future through CHWCMR's platforms.
Thank you, Sarita. Well, la pregunta en español es, sabemos, y gracias Alma, siempre nos das unas buenas preguntas. Sabemos que la comunidad más vulnerable son los trabajadores del campus, canarias o de la construcción. Todos ellos pueden ser que también sean los más fáciles de contraer la enfermedad. Y queremos saber si pues el Departamento de Salud los apoya. Entonces, Sarita dijo, Shireen nos dijo que sí, que hay programas para apoyar a estos trabajadores cuando están enfermos. Ella puede compartir el link donde pueden asistir. A veces se les da asistencia médica, asistencia con los comidas y con algunos biles que tienen que pagar, y que dependiendo de dónde ustedes están localizados, esos programas se pueden todavía estar activos porque por la falta de fondo, porque ya saben ustedes que, como dijo Sarita, se ha cambiado de estar, como dicen, en red a hielo, diría yo. Los fondos también han disminuido, pero sí se da. Y también la Cámara de Comercio, que protege a las personas que tienen dueños de negocios en el estado, también tienen fondos adicionales para ayudar tanto a las personas con negocios como a nivel personal. Así que pueden visitar la Cámara de Comercio. Thank you, Sarita and Shireen, for all this wonderful answer and information that we needed in the community, because we are, the bridge between you and the community. We need to be updating information, to have the updating information to be able to answer our community. Entonces, muchas gracias, Sarita y Shireen, por todas las respuestas, porque sabemos que tenemos que estar bien entrenados para contestar, ya que somos el puente entre la comunidad y ustedes para llevar esta información, una información que es verdadera y que no es falsa, ¿verdad? Entonces, we want continue with the message today, and we have Anastasia, and she say, good evening, everyone. Welcome, Sarah and Shireen. Thank you for all the information that you are sharing with us. Gracias, Anastasia. And I know Anastasia, she is from Skagit Valley. And Sandra Aquino, Dr. Ponce, I am totally agree with you that we need to continue to protect us by using the face masks. El COVID-19 is alive. It's true. And we say that, I like that. Maybe we are, the COVID-19 is alive. I like that. Danilo Gomez is our champion from Snohomish. He said, thank you for the information that you're giving to us through this program. We love it. That. Thank you, Danilo. And thank you so much. And we are going to go to another informative shortcut.
El COVID-19 es una enfermedad causada por el virus coronavirus. Algunos síntomas de COVID-19 son fiebre, dolor de cabeza, fatiga, dolor de garganta, tos, dificultad para respirar y náusea, entre otros.
If we have COVID-19 or shake someone's hand or touch these things and then touch our eyes, mouth, or nose, germs can get onto us.
Todos los niños de 6 meses en adelante deben vacunarse contra el COVID-19.
COVID-19 vaccines help prevent from children getting seriously ill from COVID-19.
Vaccination against COVID-19 helps keep children safe at school.
Este mensaje es patrocinado por Community Health Worker Coalition for Migrants and Refugees y el Departamento de Salud del Estado de Washington. Para más información, visita doh.wa.gov/COVID-19.
Hi, we see the information from our champion children. My mom says something, Sarita and Shireen. She said there are two people that always spoke the truth, and these are the children and the drunkards. Sarita and Shireen, I wanted to, les quiero compartir a todos ustedes también que mi mamá dice que hay dos personas que dicen la verdad, que son los niños y los borrachos. Then this is why our children are talking to you to get the vaccine, because it's important and they wanted to be protected. Either you don't believe in the vaccine. Es por eso nuestros niños les hablan a ustedes y ellos sí se quieren poner la vacuna, aunque sus padres no. Hay que protegerlos. y los niños dicen la verdad. Okay, we are going to continue with our program, and because we are getting almost at the end, I wanted to give the opportunity to Sarita and Shireen to talking about something and reinforce what is important to let the message today. I know we are going to have a serious conversation, and as the way the guideline is changing and the requirement, but I wanted to focus this last time in the summer and the exposure and what is expecting, and how we can protect now that we're going to the beach or we're traveling and other things like that.
Yes, no, this is such a great point. And I actually want to start by thanking you all for all the tremendous work that you're doing in support of keeping our communities safe and healthy. Seeing all the comments and the welcomes for Shireen and I means so much. The work that we do is such a blessing and so fulfilling to be able to be a bridge between the State Department of Health and community partners like yourself that are on the ground, meeting with community members, providing information and education and support. So I want to thank you first and foremost. And also just share that hearing from the children in your community, this is something that is so impactful because ultimately all that we do is for those around us, and especially our children, and keeping them safe and healthy. I'm the mom of two young boys, and as a mother, as an aunt, as a sister, you think about the actions that you take impacting the people that you love. And hearing those messages from children themselves, I couldn't agree more. We pay attention, we listen, and they are so informed and intelligent. And I just love that. So just starting with that, I think to your question about the season we're in and in the summer, absolutely. This is when, the doors open and we gather together and we socialize and we travel, whether by car, by plane, we are surrounded. And so it's more important than ever to focus on your health, do things that make you feel like you're protecting yourself. Again, I really appreciated the comment about masking, especially, if you're in an airport, if you're flying and you feel like a mask would really help protect you. Maybe if you have I have really bad seasonal allergies, and I know that wearing a mask sometimes makes me feel also like I'm protecting others just because I might have some allergy symptoms that aren't COVID related, but it still has that impact on others around. So masking is still a great way to protect yourself and others. Testing as well. If you know that you're going to be around, for example, a family gathering, especially with older members of your community and your family, those 65 and up, family members that might be immunocompromised, taking a test to be sure that you will not expose them is, again, a great way that as an individual, you can make sure that you're protecting those around you. I think the key is just to be informed. Again, if you're up to date on your vaccines, if you're up to date on your boosters, if you test, if you mask, you're doing your part really to protect those around you. But this is certainly a time to be celebratory as well. Summer is a wonderful time to gather together. So as much as you can do to really help yourself and others is great.
Gracias, Sarita. Entonces, le dijimos a Sarita y a Shireen que si tienen unas palabras finales para todas ustedes, me encantaría que las compartan. Y primero, Sarita dijo que estaba muy feliz de que su departamento del DEH estuviera trabajando y ser un puente entre el Departamento de Salud y la comunidad, en trabajar con organizaciones como nosotros, con ustedes que están ahí informando a la comunidad, dándole, ayudándola, protegiéndola para que se prevenga esta horrible enfermedad. Y que volviendo al tema de qué debemos hacer ahora que viene el verano, que ya estamos casi en el verano, creo que hoy es el primer día, es que si estamos en áreas donde hay muchas personas, no se olviden de protegerse, de usar la máscara, no necesariamente por el COVID-19. Sarita, ella tiene alergias cada vez que hay este clima, entonces ella se siente que está protegiendo también a los otros y que ellos se sienten mejor porque también ella tiene síntomas que la gente puede creer que es de COVID-19 y usando la máscara es mejor, pero que definitivamente que si van a viajar, pónganse la máscara no solamente por ustedes, sino por los adultos que están y por los niños. Y ella también nos dijo antes de que le encantaba ver a los niños porque todo esto que hacemos, ella es madre y tiene sus niños y todos los padres por lo que trabajamos, por lo que vivimos es por los niños y escucharlos son tan inteligentes y bellos en decirles la verdad y hablar del COVID-19. Thank you so much, Sarita. And then we go with Shireen.
Yeah, thank you for the opportunity to jump in. I have just another message on top of what Sarah shared is that COVID vaccines are still free for adults and children right now, but they may not be in the future. And so if you have not gotten boosted or you know community members that are curious about the COVID-19 vaccine and haven't gotten one yet, please encourage them to learn more, to talk to a trusted healthcare provider about their options, because those vaccines are free for now, but they may not be in the future. And the reason why that is because the federal government and the state government have purchased a set amount of vaccines, and they have that right now in stock and are trying to use those before they expire. And then once they're expired or they run out, they may not have them for free and they will only be covered typically through insurance. And so if you don't have insurance, really important that you try to find a way to access those vaccines. There may be more and different guidance in the future. Maybe the free component does get extended, but for right now, folks are anticipating that it will not be free in the future. And so a great chance to, as you're going to be out socializing with community and friends, to think about getting the vaccine and talk to your doctor about it.
Wow, fantastic. Bueno, entonces, Shireen saying, para decir más y aportar algo nuevo de que Sarita dijo, quiero que sepan que la vacuna sigue siendo gratuita y quiero que sepan que el motivo de que es gratuita es porque tanto el Estado compró bastantes vacunas y ellos están aplicando la vacuna todavía gratuitamente, pero ustedes saben que los fondos, ya no hay tantos fondos como cuando estábamos afectados y que no hay planes para continuar dando esta vacuna gratuitamente. Así que no se puede garantizar de que la vacuna va a seguir siendo gratuita y solamente las personas tal vez que tengan seguro pueden acceder de una manera gratuita y les va a tocar a las otras personas comprarla. Así que los invita a ponerse la vacuna ahora mientras se sigue dando gratuitamente porque el futuro no se sabe. Puede ser que esto cambie, pero hasta ahora ella no tienen información de que va a cambiar. También queremos decirles que si miran la pantalla van a ver ustedes que pueden buscar dónde están aplicando la vacuna en el localizador. Ahí está en español, en inglés y en muchas otras lenguas. Así que thank you, Sarita and Shireen. I believe we have some coming more. And I wanted to share with all of you from Alma. And she say, Alma is one of our champions that is working in the program, Shireen, that you mentioned about Care Connection. You know, that this is a program that helping people regarding the legal status to get support, economic support bill del bill. Alma nos dice que las personas que están afectadas pudieran acceder al programa de Care Connect, que debe vivir legalmente en el país o es accesible para... no, the question is that she said Care Connection is a program for everybody that living in this country or it include to only people that is documented or not undocumented. I don't know if you know about the program, but we know because we're working. And then do you want me to answer or you wanted to answer?
Yeah, I can take a first shot at it, and then feel
Yes.
free if you'd like
Yes.
to. So Care Connect, right, is intended to support community members as you call them and ask for support. They may ask questions about an address that you reside in, about your name and information. Certainly, if there's someone else living with you that you'd rather have that service go through, that is a legal citizen, that may be the option you want to go. My understanding is that they're just there to provide information about where you can get more help. So if you call them, you might say, I need food assistance, and they may not need to provide that to you directly, but they may help you find, a local food bank or someone that can help you more locally. So there are some options, and certainly community health workers, other programs in your region may be there to support you where you don't have to provide any personal information. So that would be my recommendation, is to find those organizations that can offer, like contacting a food bank directly, contacting someone directly to get masks for free. There's still those services and options available.
Entonces, Shireen, ella dice que del Care Connecting es un programa que hay, que es disponible para todas las personas que tienen COVID-19, que se les hacen algunas preguntas acerca de su identificación y si viven en el estado, pero que no necesariamente tienen que utilizar solo Care Connection. Hay otros lugares donde ustedes pueden acudir que les pueden ayudar con proveer comidas para cuando están en cuarentena, o les pueden ayudar también con máscaras. Pero para más información también les ponemos esta website donde pueden ir a emergencias y se pueden inscribir en Core Connection. I want to take this opportunity to thank you to our partner from Care Connection in Olympia, Thurston, because we're working with them and they do a wonderful job, to provide for food, assistance to everybody that call that need assistance to take quarantine. They have to be like 2 weeks in the house, and they provide also with support to pay the bill if the person is unable to pay during the COVID-19. Entonces quiero tomar esto para darles las gracias a nuestras personas que trabajan en Care Connection en Olympia. Estamos trabajando con ellos. Es un programa muy bonito que presta ayuda a todas las personas para que se queden en cuarentena por 2 semanas y puede pagar los biles que no puede si eso es a causa del COVID-19. I can't believe we passed the hour and I feeling that there are more questions. But the good thing is that we are going to continue with this program with Sarita and Shireen and maybe other members of the Washington DAs. But we are happy you are here. And I really, truly appreciate from the bottom of my heart on the behalf of all community health workers, your support to keeping us informed and to helping us to help our community to get vaccinated and get the information they need to know to take a smart decision about how to protect them and their family of the COVID-19. Bueno, quiero darles las gracias en nombre personal y de la coalición por estar en este programa, invitar a ustedes, no va a ser la primera vez, vamos a tener otros programas, tal vez se va a unir otro miembro. Y también quiero darles las gracias por el apoyo que nos dan a nosotros y todos los community health workers para que sigamos protegiendo a nuestra comunidad y a nuestros hijos con la información que necesitamos saber para tomar decisiones importantes y sabias acerca de nuestra salud. Thank you and God bless you. And you are in our hearts.
Thank you so much for having us. It's wonderful to see you.
Thank you. And thanks for the great questions. Yes. And of course, like Sarah said, all the wonderful work you all are doing. It's really important. And we're looking forward to hearing more about what questions you and the community have in the future.
Thank you. Thank you, Shireen. And Shireen say que gracias y que todos hicieron unas muy bonitas preguntas y que ellos quieren continuar con nosotros para responder esas preguntas que vamos a tener en el futuro. Así que thank you so much.
Thank you.
COVID-19 can be transmitted from person to person through a cough or a sneeze.
Children receive